My name is Dr. Roger Härtl. I'm the Chief of Spinal Surgery and I'm the co-director of the Spine Center here at Weill Cornell. Hey, how are you? You want to take this off? Do you mind? We see the full spectrum of spinal disorders, degenerative changes of the lumbar, cervical, thoracic spine, spinal stenosis, herniated discs. We see a lot of patients who come in after car accidents with traumatic injuries. Any patient who comes now to our intensive care unit with a severe traumatic brain injury or with a spinal cord injury can really expect to get the absolute state-of-the-art treatment here. Can you lift up your arms like that? Close your eyes, keep your arms up. Okay, very good. Our interest is really in pursuing minimally invasive surgery whenever possible. That means in the cervical, thoracic, or lumbar spine, that instead of making big incisions where we have to take down a lot of muscle, where we can potentially cause a lot of injury, that we try to really limit our surgical exposure to the absolute necessary amount to reach the side of the problem and to treat that pathology as effectively as possible. So we'll see you back in 6 weeks with more x-rays? Good. Thanks for coming in.
Thanks, Roger.
In the operating room, we use computer navigation when we're dealing with the upper part of the cervical spine, where there is the spinal cord, a lot of blood vessels that go into the brain, where for obvious reasons you want to be as precise as possible, and computer navigation very elegantly allows you to do that. We use microsurgical techniques, so most of our operations we do under the microscope. Instead of using titanium or metal instrumentation, we've been using instrumentation made of absorbable, biocompatible materials. A few years ago, characteristically, patients would stay in the hospital for a very long time period, and that has now really dramatically changed. One of the main differences now is that we really put emphasis on mobilizing patients early on, and we can do that because our surgical intervention is very minimally invasive. There's not that much pain involved after surgery, and usually that allows patients to get out of bed earlier, and it allows our physical therapist to work with these patients to really get them into an appropriate rehab facility or back home as soon as possible. I work very closely with patients with sports injuries. I work, for example, with the football team, the Giants. We have established a chain of emergency interventions that includes helicopter transport to the hospital, rapid transfer from the emergency room to the intensive care unit or to the operating room as necessary. Research has shown that if you treat these patients very effectively early on, that there's a very high chance that you can actually prevent more severe injury from happening or even reverse neurological deficits. Working within the Spine Center is indeed very, very exciting. The understanding now that spinal disorders are very complex. There's so much more now going on in terms of minimally invasive surgery, and we're constantly working on making the techniques that we're using right now even more safer, less invasive, and more effective. The one intervention that we think is the least invasive and most effective for any given patient.